I'm getting close to retirement age, 63, 64, 65, somewhere in there.
You're a long ways away from that.
Bless him. Thank you. But for the people on the street who are, wondering about that, what are they supposed to do about insurance? That must get worrying for people. It's a huge question.
It is.
What do I do?
It is. And we have a lot of companies who will send their HR departments, send their employees into us so that they can ask us what they should do. And so it's an individual thing, depending on the insurance coverage that you may have, depending on how much you're having to pay for your insurance. We'll have a big determination whether you're going to sign up at 65 for Medicare Part A and or B. Some people can waive Part B coverage and for a little later on because they're actively employed and they have a group health insurance plan that covers them. That's the only exception to the rule for people to not really go on to Medicare Part B.
Otherwise, do they get a penalty?
Yes, otherwise they'll get a late enrollment penalty and they won't be able to enroll when they want to.
Okay.
And so for each year they didn't sign up on Medicare Part B, there's a 10% penalty that they would pay in addition to their Part B premium.
Okay.
So it's important that they come in and they understand those rules and laws, because we've had a lot of people have to pay those penalties because they haven't understood them.
Okay.
So we try to go through whether they come in at 63, right at 65, 64, and they're just asking questions.
Right.
We don't care. We want to at least give them the advice as to what they can expect, and then if they do wait for Medicare Part B, we have forms and so forth that they actually take to their employer to show that they've had that coverage when they want to sign up on Medicare Part B.
Okay.
And so, again, it just depends on their coverage, how much they're paying. Some people will just enroll into Medicare Part A and B because it's a lot more cost effective to them and better coverage.
All at one time, you mean?
All at one time.
Okay.
Other people will sign up just on Part A because they have great insurance through their employer and they're not paying a lot for it, hardly anything out of pocket.
Okay.
And so it's better for them not to sign up on Part B. They can save that Part B premium. Some people are contributing into an HSA, a health savings account, so they have a high deductible plan. If they want to be able to continue to do that because they want to save some big money for retirement down the road, we can't even sign them up on Part A because then that makes them ineligible to be able to do that. So we try to look at the whole picture, then come out and say, okay, this is what you should do. You should wait to enroll until you get ready to retire, or you should probably look and possibly do it now.
Right now.
So every person's different. And
Well, it just sounds to me like for the sake of a phone call, you're going to be saving a heck of a lot of headaches.
Right. And
People sitting at home trying to figure out all of this by themselves, it's just going to be a nightmare, isn't it? Come in and see you. That would be your best advice.
that would be it. And again, we're not going to charge you a consultation fee or anything like that. Most people will always come back when it's time
Yeah.
to enroll in Part B and get into their Medicare Advantage or a supplemental type policy. So that's how we get eventually paid. And so don't feel like you're going to come in and you're going to get an attorney fee in here and we're going to charge you $300 when you walk out the door. It really won't cost you anything, but we think it's very important that you learn and plan for what's coming.
A huge benefit, yeah. So come on down, see Bob and his staff here at LSS Insurance. Really, the only way to go as far as I can see, because it's just too complicated to think about by ourselves. Thanks, Bob.
Thank you.